What if I told you that your blood sugar isn't just affected by what's on your plate, but by what time you wake up, how often you sit, how deeply you sleep, and even what you feel in your chest when no one's watching? Most people try to control diabetes with diet alone, but they're missing the daily habits that quietly shape their blood sugar every hour of the day. In this video, we're going beyond food, because when you unlock these simple but powerful daily habits, your A1C drops, your energy returns, and diabetes no longer controls you. You control it. Stay with me. These changes everything. Number one, regular blood sugar testing. For anyone managing diabetes, there's one foundational habit that can make or break your progress, and that's regular structured blood sugar testing. It may seem simple, even repetitive, but it's one of the most powerful tools for reversing diabetic damage and taking control of your health. According to recent research, diabetics who test their blood glucose regularly, at least 4 times daily, are 60% more likely to maintain an A1C below 7%, the gold standard for long-term blood sugar control. Even those who test twice daily can see A1C reductions of 0.8% to 1.5% over time, simply by adjusting food, medication, or activity based on what they learn. Let's break that down. Your blood sugar isn't static. It fluctuates all day based on your meals, stress, movement, and even sleep. Testing before meals helps establish a baseline. Testing 2 hours after eating reveals your postprandial glucose spike. This is critical because research shows post-meal spikes above 180 milligrams per deciliter can increase oxidative stress and damage blood vessels, even if your fasting glucose looks okay. And testing before bedtime helps prevent overnight hypoglycemia, which occurs in up to 40% of insulin-using diabetics and often goes unnoticed. Want even more control? Try pairing your test with food journaling or a glucose tracking app. You'll start to see patterns like how half a cup of brown rice keeps you under 140 milligrams per deciliter, but that white bread sandwich shoots you past 200. These patterns are your metabolic fingerprint, and by understanding it, you can adjust your carb intake, insulin dose, or walking schedule to stay in a safe range. According to the American Diabetes Association, the ideal target is 80 to 130 milligrams per deciliter before meals and below 180 milligrams per deciliter 2 hours after eating. If you're not on insulin, even testing once in the morning, fasting, and once after your largest meal can uncover critical insights. Over time, that small habit reduces the risk of complications like diabetic neuropathy, retinopathy, kidney failure, and heart attacks, which, by the way, diabetics are 2 to 4 times more likely to experience. Here's the truth. Your glucose meter isn't just a device, it's your daily dashboard. It gives you real-time insight into how your choices are affecting your body. And when you use it regularly and reflect on what you see, that's when you shift from managing diabetes to mastering it. Number two, healthy eating. If there's one habit that rewires your blood sugar, protects your organs, balances your hormones, and can even reverse diabetic complications, it's healthy, intentional eating. But let's be clear, this doesn't mean dieting, restriction, or bland meals. It means learning how to eat in a way that works with your blood sugar, not against it. Research consistently shows that adopting a balanced, whole food-based, diabetic-friendly diet can lower A1C by 1 to 2%, reduce LDL cholesterol by up to 20%, and slash the risk of developing kidney disease by 30 to 45%. Here's where it starts. Carbs. Not all carbs are created equal. Refined carbs like white bread, pastries, and soda can spike blood sugar within 30 minutes and cause levels to shoot above 200 milligrams per deciliter. But complex carbs like quinoa, steel-cut oats, and lentils are high in fiber and digest slowly, resulting in a gentler glucose rise. Aim for no more than 45 to 60 grams of total carbohydrates per meal, paired with at least 10 grams of fiber and 15 to 20 grams of protein to help slow digestion and blunt blood sugar spikes. This simple ratio alone can reduce post-meal glucose peaks by over 40%. Fat matters too, but it has to be the right kind. Trans fats and saturated fats from processed foods increase insulin resistance and inflammation. In contrast, healthy fats from avocados, Nuts, seeds, and olive oil actually improve insulin sensitivity by up to 30%, while helping your body absorb fat-soluble vitamins like A, D, E, and K1 study showed that when diabetics replaced 5% of their daily carbs with unsaturated fats, they saw a significant drop in fasting insulin levels and HOMA-IR scores, a marker of insulin resistance. And then there's timing. Eating within a 10 to 12-hour daily window, called time-restricted eating, has been shown to improve glucose control and reduce morning sugar levels by 20 to 25%. Eating your largest meal earlier in the day and minimizing late-night snacking supports your circadian rhythm and gives your pancreas time to rest overnight, which is critical for insulin repair. Portion control is also key. For most diabetics, 1 cup of cooked whole grains, half a plate of non-starchy vegetables, a palm-sized portion of lean protein, and a tablespoon of healthy fat creates a balanced, blood sugar stabilizing meal. Over time, this eating pattern doesn't just prevent complications. It can actually heal insulin pathways, protect beta cells in the pancreas, and lower inflammatory markers like CRP and IL-6. Healthy eating isn't about giving up what you love. It's about upgrading what you eat, so every bite moves you closer to healing. And when done right, this habit becomes a lifestyle that fuels your energy, lowers your blood sugar, and builds a body that's not just surviving, but thriving. Number 3, movement and physical activity. If there's one habit that acts like natural insulin, it's movement. And not just intense gym sessions. Simple, consistent, daily physical activity is one of the most potent tools a diabetic can use to improve insulin sensitivity, lower blood sugar, and protect nearly every organ under threat from chronic glucose elevation. When you move your muscles, whether you're walking, stretching, cleaning the house, or dancing around the kitchen, you're activating a built-in system that helps shuttle glucose out of your bloodstream and into your cells. And here's the incredible part. Your muscles don't even need insulin to do it. Studies show that a single 20-minute walk after meals can reduce postprandial blood sugar spikes by up to 30%, especially after carb-rich meals. That's because your muscle contractions open glucose transport channels, bypassing insulin and allowing blood sugar to drop more efficiently. But the magic doesn't stop at one walk. Engaging in moderate physical activity, just 150 minutes a week, or about 30 minutes a day, 5 days a week, can lower A1C by 0.7 to 1.5%, the same range as many oral diabetes medications. And when that movement includes resistance training, things like bodyweight exercises, lifting light dumbbells, or using resistance bands, you build muscle mass, which increases your body's glucose storage capacity and makes your metabolism more efficient 24/7, even at rest. Movement also improves circulation, especially to areas like your feet and extremities, which are often compromised in diabetics. It lowers blood pressure, reduces stress hormone levels, and stimulates the release of brain-derived neurotrophic factor, BDNF, which helps protect against the cognitive decline diabetics are at higher risk for. And the emotional benefits? They're just as real. Regular activity boosts serotonin and dopamine, helping ease the depression and anxiety that often accompany blood sugar imbalances. Even better, when you make movement part of your daily rhythm, not something you do just to burn calories, but something you build into your lifestyle, you create a sustainable path to healing. Take a walk after meals. Stand and stretch every hour if you work at a desk. Choose stairs over elevators. Park a little farther. Dance while cooking. These little changes, repeated day after day, create momentum. And over time, momentum becomes transformation. Physical activity isn't a punishment for having diabetes. It's a gift your body still responds to. And every step you take isn't just movement, it's medicine. Number 4, stress management. There's one powerful factor that can silently raise your blood sugar, block your insulin receptors, worsen your sleep, and even sabotage your best meals and workouts. And it's not even food. It's stress. And for diabetics, unmanaged stress can be just as damaging as high-carb diets or lack of exercise. When you feel tense, overwhelmed, frustrated, or anxious, your body releases a flood of stress hormones, mainly cortisol and adrenaline. These hormones, designed for short bursts of survival, signal your liver to release stored glucose into the bloodstream, giving your body a false boost of energy. But if you're not running from danger or physically burning that sugar off, your glucose levels rise and stay high. Research shows that chronic stress can increase blood sugar levels by 20 to 40%, especially in people with type 2 diabetes. In fact, just one emotionally stressful event can raise fasting blood glucose by 15 to 25 milligrams per deciliter, even if no food was consumed. And it doesn't end there. Prolonged stress raises cortisol throughout the day, which increases insulin resistance by 30 to 40%, making it harder for your cells to absorb glucose. That means even healthy foods can cause spikes. It also lowers leptin, the hormone that tells you you're full, and increases ghrelin, the hunger hormone, making you crave sugar, carbs, and fat. This double effect not only raises your glucose, it also contributes to weight gain, abdominal fat, and poor sleep, all of which loop back and make diabetes worse. But here's the hopeful part. Stress management is medicine, and it starts working almost immediately. Deep breathing exercises, done just 5 minutes twice daily, have been shown to reduce cortisol levels by up to 50%, improving insulin sensitivity and lowering fasting blood sugar by 10 to 20 milligrams per deciliter over time. Mindfulness meditation, practiced consistently for 8 weeks, can reduce A1C by 0.5 to 0.7%, according to behavioral science research. Walking outdoors in natural light for 20 minutes a day can decrease daily stress load and reduce blood pressure, which is elevated in over 70% of diabetics. Gentle yoga or Tai Chi, done 2 to 3 times per week, improves vagus nerve tone, an essential regulator of the parasympathetic nervous system, and directly lowers post-meal glucose by 15 to 30%. Stress isn't just a mood issue, it's a hormonal, metabolic, and inflammatory disruptor. But when you take daily action to calm your nervous system, you create an internal chemistry that lowers your blood sugar, protects your cells, restores energy, and helps your body respond to insulin again. In that moment, you're not just managing stress, you're reversing the damage it once caused. Number 5, foot care. There's one part of your body that quietly absorbs every step, carries the weight of your day, and yet suffers the most damage when blood sugar runs high, and that's your feet. For diabetics, foot care isn't cosmetic. It's a non-negotiable habit that can literally mean the difference between healing and hospitalization. Over time, high blood sugar causes damage to both large and small blood vessels, reducing circulation and starving your feet of oxygen and nutrients. It also damages nerves, a condition known as diabetic peripheral neuropathy, which affects over 50% of people with diabetes. This nerve damage reduces your ability to feel pain, pressure, or heat. So a small cut, blister, or burn may go unnoticed until it becomes infected. And here's where it gets dangerous. Poor circulation slows healing, and infections can spread fast. In fact, research shows that diabetic foot ulcers affect up to 15% of diabetics, and nearly 1 in 5 of those cases result in amputation if not treated early. But the good news? Daily foot care slashes this risk dramatically. Just 5 to 10 minutes of foot-focused self-care every evening can reduce your risk of ulcers, infections, and skin breakdown by over 60%, according to diabetic health studies. It starts with awareness. Check your feet every day in good lighting. Look for cuts, cracks, dry patches, blisters, or color changes. Use a mirror if needed or ask for help. Wash your feet gently in warm, not hot water, then dry thoroughly, especially between the toes. Keeping the area dry prevents fungal infections, which are common due to suppressed immune function in diabetics. Follow with a fragrance-free moisturizer to prevent cracks and skin breaks, but avoid putting lotion between the toes to prevent moisture buildup. Trim your nails straight across, never rounded, to avoid ingrown nails, and always use clean tools. Wear socks made from moisture-wicking cotton or bamboo fibers, and avoid tight, non-breathable shoes. Choose footwear with arch support and enough space to wiggle your toes, as even a slight pressure point can lead to an ulcer if ignored. If you're exercising, especially walking or hiking, check your feet before and after. And never go barefoot. not even indoors. Studies show that diabetic patients who practice daily foot inspection, moisturization, and protective footwear habits reduce their hospitalization rate by over 50% due to foot-related complications. And here's one more essential layer. Schedule an annual comprehensive foot exam with your healthcare provider. It may take 10 minutes, but it can detect early signs of poor circulation, loss of sensation, and hidden pressure points that could turn into future wounds. Preventing diabetic foot problems doesn't start with surgery or antibiotics. It starts with simple, daily attention. And when done right, this habit protects your mobility, independence, and quality of life. Number 6, sleep. Sleep isn't just rest, it's regulation. For someone living with diabetes, sleep plays a central role in blood sugar control, insulin sensitivity, hormone balance, and even protection against the very complications that make diabetes so dangerous. And yet it's one of the most neglected habits. According to national sleep surveys, nearly 70% of diabetics report poor sleep quality, and over 50% struggle with insomnia, sleep apnea, or frequent night wakings. But here's what most people don't realize. Even one night of poor sleep can raise fasting glucose by 20 to 30 milligrams per deciliter the next morning and reduce insulin sensitivity by 25 to 35%. In fact, chronic sleep deprivation is now considered a direct contributor to insulin resistance, on par with a high-sugar diet or sedentary lifestyle. Here's how it works. During deep sleep, your body resets key hormonal systems, especially cortisol, insulin, ghrelin, and leptin. If you don't sleep deeply or long enough, cortisol remains high, keeping your blood sugar elevated through the night. Simultaneously, ghrelin rises, stimulating hunger, while leptin, your satiety hormone, drops. That hormonal imbalance doesn't just leave you tired. It makes you crave sugar, overeat carbs, and store more belly fat the next day. Studies show that people with type 2 diabetes who sleep less than 6 hours per night have up to 48% higher fasting insulin levels compared to those who sleep 7 to 8 hours. And that's not just about energy, it's about whether your body can use insulin or ignore it. Deep restorative sleep also plays a key role in protecting the organ's diabetes targets. During stage 3 non-REM sleep, your body repairs damaged blood vessels, detoxifies brain tissue, regulates immune function, and restores nerve health. Missing this stage over time increases the risk of diabetic neuropathy, memory problems, high blood pressure, and cardiovascular events. But here's the hopeful part. Sleep is trainable. Creating a consistent bedtime routine, going to sleep and waking up at the same time daily, has been shown to improve A1C by 0.4 to 0.6% in just 8 weeks. Turning off screens an hour before bed, reducing blue light, and limiting caffeine after 2 p.m. can reduce nighttime cortisol by up to 35%, making it easier to fall asleep and stay asleep. For those with sleep apnea, a condition present in up to 80% of obese diabetics, using a CPAP machine can improve overnight oxygenation, lower blood pressure, and reduce glucose spikes during the night. Even simple changes, like using blackout curtains, cooling your room to 65 to 68 degrees Fahrenheit, or listening to guided breathing before bed, can reduce nighttime awakenings and improve sleep quality. And when sleep improves, everything else follows. Your cravings reduce, your insulin works better, your morning glucose stabilizes, and your mood, energy, and mental clarity rise. Sleep isn't a luxury, it's a metabolic necessity. For a diabetic, mastering sleep is like giving your pancreas, your heart, your brain, and your nerves a nightly dose of healing. And it might just be the most powerful medicine you never knew you were missing. Number 7, quit smoking. Smoking doesn't just damage your lungs, it magnifies every threat diabetes already places on your body. It doubles your risk of heart attack, it triples your risk of kidney failure, and it increases your risk of developing diabetic neuropathy, the painful nerve damage in your hands and feet, by over 60%. That's because smoking constricts your blood vessels, reduces oxygen flow, and increases oxidative stress throughout your body. And when combined with high blood sugar, it becomes a perfect storm. Together, they accelerate the damage to your arteries, harden your blood vessels, and fuel chronic inflammation, making it far harder for insulin to do its job. In fact, smokers with diabetes are up to 40% more insulin resistant, meaning they need more insulin for the same result, and are more likely to experience dangerous glucose swings throughout the day. But here's the hope. Your body starts healing the very moment you quit. Within just 24 hours, your risk of heart attack begins to drop. Within 2 to 3 weeks, circulation begins to improve. And within 3 months, insulin sensitivity increases by up to 25%, making your blood sugar easier to control. Research shows that diabetics who quit smoking reduce their risk of cardiovascular death by 30 to 50% and improve their kidney filtration rate, a key marker of kidney health. Even the eyes respond, because quitting smoking lowers the progression of diabetic retinopathy, one of the leading causes of blindness in adults. Nicotine withdrawal isn't easy, but it's easier than dialysis. It's easier than amputation. And it's easier than living with a body that feels like it's shutting down. Thanks for watching, and I'll see you in the next video.